Today we will be talking about various contraceptive methods, a comprehensive overview. So first of all, we should understand what is contraception. So contraception is referred to the method used to prevent pregnancy, allow individual to plan their family and spaces pregnancy, essential for the reproductive health. There are number of contraceptive methods available, each with its own advantages and disadvantages. So coming to the categories of contraceptions. So there are contraceptive method can be broadly categorized into four main groups. So first one is barrier method, second one is hormonal method, third one is intrauterine device and surgical sterilization. Coming to the barrier method. So barrier method is basically physical barrier that prevents sperm from reaching the egg. So example of it are male condoms, female condoms and spermicide. Talking about advantages of barrier method are readily available without a prescription, do not interfere with the hormones, and can protect against sexually transmitted diseases also. Disadvantages of barrier method are they using it correctly requires planning and may disturb intimacy. Condoms can break, slip into if not used properly, and reduce its effectiveness. Spermicide may cause irritation in some people. Now coming to the hormonal method. Hormonal method work by regulating hormones to prevent the ovulation and release an egg from the ovary. This creates barrier from sperm or prevents fertilization. The common hormonal method includes birth control pills, patch, and the vaginal rings and the shots. Advantages of hormonal method are they are highly effective when it's used correctly. It can regulate our periods and also improves acne. But there are also some disadvantages. It may not be suitable for everyone due to the health consideration. It can cause side effects like nausea, headache, breast tenderness, and it may require a prescription. Coming to the intrauterine device, it is a T-shaped device inserted into the uterus to prevent the pregnancy. So there are two main types. First one is copper IUDs and second one is hormonal IUDs. Now copper IUDs are rely on a copper to impair the sperm function, and hormonal IUDs release hormones to thick the cervical and mucosa to suppress the ovulation. Advantages of IUDs are highly effective and long-lasting. It is reversible and requires minimal maintenance once it is inserted. Coming to the disadvantages, insertion and removal of these devices require healthcare providers. Some users may experience cramping or irregular periods, irregular bleeding during the insertion. Irregular bleeding during the insertion, and while their body adjusts to the IUDs. IUDs may not be suitable for everyone, particularly those with a certain health conditions like pelvic inflammatory diseases and uterine fibroid. Now talking about surgical sterilization. Surgical sterilization is a permanent method of contraception for both men and women. So in men, what we do is vasectomy. It is a minor surgical surgery that blocks the tube, carries the sperm from the testicle. And in female, tubular ligation. In that scope, it is a laparoscopic procedure that blocks or closes the fallopian tube, prevents the egg from traveling the uterus. Now, talking about the advantages of surgical sterilization offers highly effective and permanent solution for the individual certain about not wanting future pregnancy. There are no hormones or devices are involved, so eliminating the need of ongoing maintenance. Now, disadvantages of it, it's a permanent procedure, requires careful consideration and discussion with the healthcare provider, and may not be readily reversible. Now, there is also something called fertility awareness method, that is FAM. So in this, what we do is track our menstrual cycle changes to identify fertile and non-fertile window. This requires abstinence or using the barrier method during the fertilized day. For example, basal body temperature tracking and cervical mucus tracking. Now, advantages of FAM are FAM offers several advantages. It's a natural approach to the contraception free from hormones or any device. Simply by tracking your cycle, you gain the valuable insight about your fertility pattern. So, FAM can be used by both to prevent a pregnancy by avoiding the sex during fertile days or planning the pregnancy by identifying your ovulation for conceiving. Now, what are the disadvantages of FAM? It offers various benefits, but it also has the disadvantages like it requires dedication and consistent effort to track your cycle. FAM is typically less effective in the preventive pregnancy compared to other methods with high user failure rate. So additionally, FAM may not be suitable for everyone, particularly with those who have irregular period cycle or difficulty in identifying their fertile window. Now talking about emergency contraceptives. Emergency contraception offers refer to the morning after pills. It's not a regular birth control method. It is intended to prevent a pregnancy after unprotected intercourse or if your usual contraceptive method fail. So emergency contraception is the most effective when when it is taken within the 72 hours, that is 3 days of unprotected cell. It works by delaying or preventing ovulation or fertilization. There are two types of contraceptive pills are available. Now coming to the conclusion, various contraceptive methods are available to suit the individual need and preferences. Consulting healthcare providers is essential to discuss your options and choose most suitable option or method for you. So responsible contraception empowers individual and promotes the reproductive health. Thank you.